Hello guys, welcome back. It is Thursday afternoon and we're back with another IG Live. Today's topic will be body contouring after massive weight loss, and we'll have a special guest, Desiree Augusto. He's one of our patients who's gone through a tremendous transformation, and so we're going to hear sort of first person perspective about her transformation, the path through the weight loss, and then the body contouring after the weight loss. So I see she just joined us. I'm gonna get her to join in. Awesome. Hey, how are you?
Good, how are you?
I'm doing great. Thanks for taking time to come and chat with us. So,
No problem.
just to introduce you, Desiree is one of our patients. As I mentioned previously, she went through a dramatic weight loss transformation. And after that, she came to us and had a body contouring procedure, tummy and breasts. And I wanted to invite her today to talk to us to get a sort of first person perspective about her journey, about a patient who went through weight loss and then the body contouring. um, it's interesting to hear from someone, on their own words on what they went through, and also want to highlight the importance of the weight loss before surgery. We often get a lot of people contacting us who misunderstand cosmetic surgery and think that cosmetic surgery is really like weight loss surgery. There's a lot of pictures out there that show these dramatic transformations. You see surgery accounts showing these beautiful transformations of someone's like really, really large to a completely transformed body, but you miss the part in between, which is the weight loss. You can't really go from somebody who's a BMI of
Mhm.
50 look like you BMI of 18. There's no amount of cosmetic surgery that can really do that. So there's a first step where the patient has to do things on their own, and then once they've done their part, then you come to a surgeon, and the surgeon does the cosmetic reconstructive body contouring procedure. So I'll let you take over for a little bit. Maybe you can tell us about your journey. Um, where you started, how you started, what inspired you to go through the weight loss transformation, and then after you lost the why did you decide that you wanted to go ahead and have body contouring procedures?
Okay, so rewinding quite a number of years, mainly through my teens. Like once I turned into a teenager, I gained weight, and it just, as the years went on, it packed on and on and on. And a lot of people, they tend to do it as like the mommy makeover after they have kids and whatnot. But I was actually a rather big girl before I had my daughter.
Mm-hmm.
So I spent my whole life always doing something. I always enjoyed exercise, but I was always large.
Mm-hmm.
I made very poor choices with my eating habits and those such of things, and that's why it led to what it did. So prior to what I found that worked for me, I did martial arts and running and a lot of that kind of stuff for many years, but I consistently overate and ate the wrong things. So I started doing Kangoo
Mm-hmm.
jumps, which is like these bouncing boots, and
Okay.
mixing that with a clean diet. It's been drilled into me now, and now I understand how it all works. And it's been drilled into me like I have to put in what I put out kind of thing. You know what I mean?
Exactly.
And so I worked really hard for about 4 years with the Kangoo and strength training, lots of cardio, lots of lifting weights, and lots of paying attention. The biggest thing is like reading the labels, paying attention, be accountable for what you put in, and then be accountable for what you put out. Like it has to even out
Mm-hmm.
eventually, you know? Um, and then prior to that, I always did say, I just want to lose weight. I just want to be small. I just want to be like that girl. I want to be like this girl. And even like that is fine. I was always just so big. And then I never thought I would ever lose the weight. And then I also thought if I did lose the weight, I always had these really, really big breasts. And I always thought, you know what, if I lost some of them, that would be okay. I wouldn't be upset about it. Well, let me tell you, the bigger everything is, the harder everything falls.
Yeah.
Gravity is a serious thing, and everything kind of sagged. My belly, I'm fortunate with my legs, I guess. The skin laxity there is still okay, and my arms as well. But mainly my belly and my breasts, it was
Mm-hmm.
like, it got to the point with my breasts, like I'd be running up the stairs and they would applaud for me, the skin would just, good job, girl, you made it up the stairs. So I quickly changed my train of thought, and I thought, you know what? Maybe it does kind of upset me that they're gone. and maybe I don't like the way it looks, you know, it was just a lot of skin. And that's when I started really contemplating it. I had known quite a few friends that had gone through similar things, like where they had either lost weight or the baby stretched everything out, and they never had a bad experience. A lot of people that I spoke to really, you know, helped me like feel comfortable with it, because it was never really on my radar until it was on my radar, really. And then I watched your Snapchat religiously.
Mhm.
And I interviewed a few different surgeons, and I just kept coming back to you, and I went and I did it. You know, I didn't even think twice. I just kind of was like, okay, this is what I'm doing. I love the results I'm seeing, and that's what I did. And I knew that once I put that in my mind, that I'd want to go in as with as low BMI as possible. Reason for that, for me personally, I wanted to be able to grab as much skin as we could without having to go in and do a lot of lipo and a lot of all that other stuff. You know, I
Yeah.
figured the less we went in and aggravated things, the easier it was going to be for me.
Yeah.
And then coming out of surgery, I knew I was going to be sitting still for a really long time. You know what I mean? So I wanted to actually come in under my ideal, and I did. I came in about 5 or 6 pounds under what I ideally like to sit at,
So
and
what
I was
what
totally
was
fine with
what was your what was your heaviest weight? What was the max you ever reached in terms of your weight?
Well, that being said, I'm only 4'10", so I'm really short. And I was probably, I couldn't tell you 100%, but somewhere in the 170 range.
Okay.
So
And what was your weight at the time of your surgery? Do you remember how much did you drop?
98 pounds.
98 pounds. Okay.
Yeah.
Amazing. So
And I like to
I,
sit at about 102, 103,
I,
104.
I can't do the calculation off the top of my head, but do you remember what was your BMI on your surgical
I
day?
believe it was like 20 or 21.
21. That's amazing. Awesome.
Yeah.
So, like you said, you were inspired to lose as much weight as possible before surgery because you wanted to make it easy on yourself. And I tell my patients, the more weight you lose, the easier it is for me to give you nice results. Someone like you who's down to 20, 21 BMI has very little extra fat. It's mostly loose skin. And so
Hmm.
you're able to really trim the skin very nicely. You don't have to worry about liposuction in areas. That really makes it easier for me to give you a nice result. So I do encourage my patients to try to lose as much weight as possible. People sometimes do try to lose weight, but they see that just no matter how hard they try, they just cannot. They've been exercising, these all these other things. 2 points that are really crucial that I think a lot of people don't realize. There is no amount of exercise that you can do to correct all the Twinkies and chocolate that you eat. Diet
No,
is so much more
no.
important than exercise.
It's
Exercise is good.
100%.
I'm not discouraging anyone from exercising, but you have to be aware of what you're taking in. And like you said, calories in, calories out. It's again the same kind of thing. The amount of calories going in minus the calories going out is what's going to affect your weight. Some people have a faster metabolism, some people have a slower. So people with slow metabolism may find it more difficult to lose the weight, but the numbers are
Hmm.
very simple. So you gotta find a
Hmm.
way of stimulating your metabolism. Now, this is difficult for most people. If you can't figure this out on your own, see a nutritionist, she has a professional that can help you. But it's a simple math: calories in, calories out.
No, that's right.
So, what was your thing? What did you do to lose the weight? What was your little trick?
Um, it was definitely, it had to be the calorie, watching my calories. I kept it at a deficit, so I made sure my biggest thing, and my trainer and very good friend will tell you the same thing. If you have like some idea of being able to track what you're putting in calorie wise. So I used a Fitbit,
Mm-hmm.
and I just kind of kept track on the Fitbit app of everything. You know, I made sure that my calories were always every single day, like that I burnt more than I took in. Like that has to be. And then the biggest thing I can say is, um, you know, this isn't like this week. It's not next month. It's not like even just this year. You know, you got to
Mm-hmm.
do this forever. This isn't something that, it's not like, okay, you know, let's do this for a while and drop 30 pounds and then we're going to go back and we're going to like drink beer and eat donuts and eat this and that. And like every now and again, we'll have something healthy. It doesn't work like that. It'll just creep back. You
Yeah.
don't do all this to be able to eat an extra sleeve of cookies. You
Yeah,
know,
so
you don't do this.
you have to
Like
be
you
very
have to do
vigilant.
it.
You have to be measuring everything. You're looking at your calories. And I don't know if you did this, but a good thing is for people, measure your weight every day. Every same time
Yeah.
of day, early in the morning, measure your weight.
In the morning. Yeah.
And you can see it go up and down. If you, for example, go up, it'll just give you a little more stimulation. You know, be a little more careful the following day. Take it
Yep.
really easy. Because if you're not paying attention, it is so easy to fall off the wagon, to just not notice what's happening, and just the weight
No.
kind of creeps up again.
It has to be a lifestyle. Like we say this so much at the gym. Like a lot of people, I teach a class 1 day a week, where I joined there, I'll be 6 years ago. And I always said, I won't teach it. I love it too much that if I start teaching it, I'm scared that I'll, you know, like lose love with it. That didn't happen. I
Mhm.
love teaching it. It's like even like so much more thrilling. And everybody that comes in, they say, you know, I've seen your stories on Becky's page, and you know, you're so inspiring. And I'm like, and you know what? That was 6 years ago I started this. Like you can do it too. It didn't take me 6 years, but here I am. I'm 6 years. I still love it. And you know what? I love it because I feel good. You know, it
Yep.
doesn't really have much to do about how I look or anything like that. But like when you're done, like you feel accomplished. Like even if you had a crappy day, you got that out. It's, you know, you got that energy out and you can move forward and be positive about it. It's just good all around, in my opinion.
I'm noticing that the word Nutella is trending up there. People know me. It's my weakness.
Yeah.
I try to keep it down just a little bit of Nutella. We have so much Nutella in the office. Our patients know that I love Nutella, so we just have jars. People are bringing jars and
My
jars. So
daughter too. My
yeah,
daughter
it's
eats it. It's a job.
thank you. So it's my little weakness, but yeah, you just, you know, once in a while you can have a cheat day. You can reward yourself, do a little cheat, but
Absolutely.
overall, stay on top of it.
You have to.
How long did it take you to lose all this weight? So was it you said a 4 year process?
So I was there for 4 years before I decided on the surgery aspect.
Okay.
I would say within like I did the biggest chunk of my losing within the first year. Within the first year, because I had gone there and I wasn't at my heaviest anymore. I had already lost maybe 25, 30-ish pounds.
Mhm.
But I've lost a good 50, 45, 50 just there alone. And that happened within the first year easily.
Okay.
And within the first 6 months, to be honest, I was like feeling the same way I felt about everything else, you know, like, okay, we're going to do this. It's fun. I'm going to lose a little bit of weight. And you know what? Actually, I started losing like 9 pounds at this check-in and like 10 pounds at that check-in. And I was like, oh my God, this is working. So then as I got going, I really started cleaning up my diet and then it was just falling off. So I'd say it took me about a year to do the 50 for sure. Um, and then just keeping it off has been maintenance now. So
Yeah.
by the time I reached year 4, I was like, there was really nothing left to lose. And I really needed to start like fixing all the
Mhm.
damage for sure.
So we mentioned previously about it's important to keep track of your calories, weigh yourself every day. It allows you to stay on top so you don't fall off. At the same time, it also gives you positive reinforcement. You see improvement every day. You see a little bit of an improvement, a
Yeah,
little extra weight
100%.
off, and it's you know, positive feedback loop. You just feel better and you just be motivated to go more and more and more. All
Yeah.
right. So you've gone through all this, and like you said, you've lost your weight, and then you were sort of sitting at your weight for a while before you decided you want to go ahead with the surgery. So was that the 4 year period? So you were at your low weight about for 4 years?
Yeah, it was about 3.5, 4 years, and I was at about probably about 100 pounds, 103, in and around there, and I was happy with that.
Why do you
It was
think
just
why do you think it was a 4 year period between you losing the weight and then finally deciding to go ahead with the surgery? What was the space, or were you not aware that the surgery was possible? Were you not concerned about the
um
extra skin? What was it?
well, okay, so that's a good question. So I was on holidays with my family, and you know, I spent so much time actually losing the weight. And I spent so much time building this self that I was supposed to be so happy about. And then we were on the beach and I was wearing a bathing suit. And every time I bend over, like my boob skin would fall out, like the whole thing, like out of my top, you know, like I'd bend over and we're like, oh, well, you know, let's roll that back up and put it back in. And then my bottoms as well, like I'd be having bottoms on and I'm like, okay, well, where do I tuck the skin? Like, where does this go? You know, like it just, I was at a point in my life where here I am. It's my first grown up adult trip back to Europe to enjoy. And I'm not enjoying myself because I can't, you know, I can't even stand what's going on. So as soon as I came back, actually, before I came back, I was actually in Portugal and I decided, I was like, yes, that's it. And Dr. Six is the guy. That's what happened. That's what really led me to it.
Okay. It's a good point to make. This is not uncommon. A lot of weight loss patients, massive weight loss patients, kind of describe similar story. They go through this dramatic weight loss and they're really happy about this, but then they realize that, you know, they have cosmetic issues, they don't look so well, and they get demoralized, and it affects them negatively. Um, Unfortunately, that there's no way around it. When you lose all that weight, you are left with a lot of loose skin. Now, people that lose weight very early on, usually, you know, closer you are to your 18 age, the better you bounce back. Your skin is more elastic, but the older you are, the less likely is for the skin to retract and come back. So you're left with a lot of loose skin. Some people tremendous amount, some people less, but there's always a little laxity, and then people feel demoralized. And some people even say, you know, I'd rather not lose the weight, or they wish the weight went back. And I would say to that, you know what, uh, the weight loss is good. People that are morbidly obese and need to lose weight, it's going to increase
Yes.
your life expectancy is going to go up, your heart disease is going to go down, your blood pressure is going to come down, your potential diabetes may be cured with the weight loss. There's a lot of medical benefits to the weight loss. The cosmetic downside to the weight loss is there, absolutely, and that's where cosmetic surgery comes in, and where cosmetic surgeons can help you to remove all the extra skin. Now, topic of cosmetic surgery after weight loss is you need to understand those two things. One, wherever you have a lot of loose skin, we can take it off, but you're going to be left with a scar, and you need to decide what's going to bother you more, having the loose skin or the scar. And the second thing is, unfortunately, once the skin has been stretched out, the elastic fibers, the elastins have been damaged, the elasticity is not the same as somebody who's never had the extra weight. So no matter how much skin tightening procedures you will have a perfectly tight body. The goal is to make you look good. The goal is not to turn back the clock, press the undo button, and make you look like you never had the extra weight.
No.
So you may look good, but you'll always be able to go and pinch the skin and pull on it. And sometimes I have people come back and say, but you know, I can still pinch here, I can still pinch there. When I bend over, I have these folds. Unfortunately, there's only so much body contouring can do. So it's really, really important that people have realistic expectations. Desiree, for example, let's talk about you. You look phenomenal. You know, I haven't seen you in a long time, so you haven't been back to the clinic. I just see the pictures you put on Instagram, and you look amazing. But I bet that even though you look so lean and skinny and fit, you can probably pinch your skin, pull on it. There is some give. It's not like rubber tight kind of skin. Am I right?
No. No, absolutely, 100%. There'll always be a little bit of skin there, and you know what? That makes us human. You know, like you
Yeah.
can't. My thing going into the surgery, especially, is you can't go in wanting to be perfect, because if you're searching for perfect, it's not out there. You know, it's not out there for anything. Nothing in life is perfect. You know, so if you're searching for perfect, the problem's in here. It's not on the outside. You know, so for me, it
Exactly.
wasn't about perfect. It was just about feeling better. That's all. You know, like
Yeah.
I wanted to put a bathing suit on and not worry about something falling out, you know?
Yeah.
That was it. Like,
That, that, that's a very important concept for everybody to consider, whether you're coming for body contouring after weight loss or anything. Understand there is no such thing as perfection. You need to have realistic expectations. Understand that there are always going to be little imperfections, no matter how hard you try.
mhm,
The real life is not like Instagram. Instagram is all filters, Photoshop,
100%.
Facetune, and people putting on their best pictures ever. I try to repost sometimes pictures people, you know, show honest pictures of themselves. There's a few kinds I keep reposting that
hmm
show the same person posing and not posing. It could be a dramatic
Yeah,
difference.
absolutely. When I post pictures, I really try to show people, like, this isn't filtered, you know? Like, I didn't do anything to this picture to make it look a certain way. Like, this is it. And this is how it is. And I feel like there's just too much fakeness that way out there. Like,
Yeah.
I definitely didn't go for the surgery for the fake aspect of it. And you know what, like you said, I'm going to touch on that scars thing. You have to be able to be okay with the scars. Like I have scars, but I mean, they're definitely no worse than the stretch marks or the skin or any of that stuff. And as the years go by, you know, it fades away and it becomes a distant memory. And then you're still left with the happiness that came from it,
Exactly.
you know? So
Exactly.
you, it's a small thing to wager, in my opinion.
And Mel made a little comment there, perfection is subjective. I totally agree. Um, we have patients that look phenomenal, absolutely phenomenal, and they're just so unhappy about some little imperfection. You can barely see, and you know they're crying in the recovery room, and I'm like, I'm frustrated because like I don't know what do I do? Like there's nothing more I can do. You look absolutely perfect, and then I have patients that, yeah, not exactly perfect, and they're so happy and they love me
Yeah.
because their expectations was met. So it's really, really important during cosmetic surgery consultation is to make sure that you express your expectations so that your expectations and your surgeon's ability match up, and you understand their limitations, what a surgeon can and cannot do. So
Mm-hmm.
beauty is in the eye of the beholder. You look amazing, and again, part of this is what I've done, and part of it is what you've done. You've done an amazing job losing the weight to get to where you were at the time of your surgery, and also after surgery, you maintain your results. You're very active with fitness. Tell us about what you did after the surgery to maintain your results, or maybe even to enhance your results.
So, directly after the surgery, I took about 6 weeks off. At 5 weeks, I started doing a little bit of stuff very carefully, very gently. By week 7, I went back to the bouncing, but very carefully again, and with 3 bras because gravity is still gravity. You know what I mean? Just because you lifted them up doesn't mean they're going to stay there. Like, you know, you need to be careful. You need to take care of your investment. And so, I just pretty much went back to my routine of minimum 6 hours a week of working out and watching what I ate the entire time leading up to my surgery. I'd say the full 8 weeks prior and 8 weeks after, I did not put a single dirty calorie in my body. Like I only ate clean, 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 clean the whole time because I knew post-surgery was going to put weight on me, and I know it's something that's going to come off, but I know the numbers are going to mess with me, especially because I can't work out. So I made sure my eating was 100% clean. I made sure I was drinking lots of water, and even now, I don't, yeah, there's a cheat day, like it maybe happens once in a while, but I'm very strict on myself with what I eat, what I don't eat, especially what I don't eat. The carbs are like, they're out the window. And now, like, I just make sure I work out every day. We're on quarantine, so it's really messed up my routine. That's been really, really hard, I'm not gonna lie. But I make sure that I do at least an hour every day. It might not be my regular routine where some days I do 2 hours and then I'll skip a day. I just, at this point, make sure I get at least an hour in every day.
Let's talk about your surgery. Walk us through your surgical day, because a lot of people may look at you and say, "You, wow, you look amazing. I want to get the same thing done," but they may be scared of having surgeries. Can you recall what happened to you?
Absolutely. I can remember it like it was yesterday. I was so excited. Um, we actually snapped my surgery so that I could watch it over and over after, and I still have it saved on my phone, and I still watch it from time to time. Oh my God. Okay, so I arrived. I stayed the night before, and I was early because I was excited. I was the first one on the table, and I came in, and we did the measurements.
Okay.
And first, actually, the nurse took me in. She asked me if I was nervous or if I needed something like to calm myself. And I joked with her and I told her, I'm like, you know what? I'm not nervous whatsoever. I'm ready. I didn't need anything at all, to be honest. I was really excited to be there. So I came in, she put me in the room. And then you came in and you did your markings and we got all ready and they took me into the room. They put me on the table and they asked me if I had any concerns. And actually, I joked with them a bunch too because I had a little cut on my finger. And I told him if he could just be careful of my finger. And he's like, oh, he was so sweet. He's like, yeah, for sure. And I was like, I'm just kidding. Like, you're going to be cutting me wide open. I'm really not worried about my finger. But honestly, like, from walking in to, I guess, getting wheeled out, because I didn't walk out, that's for sure. But from walking in to the minute I left, it was a great experience. I would totally do it again, except I don't have much left to fix now.
Now, a lot of people are terrified of going under. So I'd love to get your sort of recollection of what happened. Do you
Mhm.
remember falling asleep? And do you remember the time around when you woke up? Like, what do you recall from those experiences?
Okay, so when I fell asleep, I actually just remember they said, okay, we're gonna give you this like little prick here, and I'm guessing that was the intravenous. And then they counted backwards from 5, and I don't even remember getting past 4, to be honest. It was rather quick, and I wasn't nervous about it at all. She had like some heating packs or something on my legs, I'm not sure. But yeah, like that part was easy. And then when I woke up, that was funny too. The lady was so nice. I can't remember anybody's name, but they were all wonderful. Like the staff you have there are absolutely like top shelf. They're amazing. They're sweet. They're compassionate. And so when I woke up, she's like, Desiree, it's time to open your eyes now. It's time to wake up. And I couldn't open them. They were so heavy. They were so heavy. And I'm like, okay, I can't open them yet. And she's like, okay, that's okay. Take your time. And I remember thinking, geez, they feel really heavy. And then I'm like, okay, well, I can't open my eyes yet. I'm like, how do my boobies look? She's like, oh, they look great. And then I just continued to talk to her until my eyes opened, and it was fine. I think most people, the anesthesia makes them sick. I only got sick maybe twice, maybe. I don't even remember getting that sick from it. I did get like there was a couple of dizzy spells, yeah, but
Mm-hmm.
going under was easy. Coming out was fine as well. I mean, everybody probably is different, but their tolerance levels, I guess, are different. But I think the main thing is if you go in and you're so positive in here and you know it's going to be a good thing and you know it's going to be great, then coming out, you're going to wake up the same way. So if you go in scared, terrified, freaking out, that's going to be the last thing you remember. And waking up, you might remember, like you might wake up that way. And I didn't want that for
You're,
me. So
you're,
I
you're
made
absolutely
sure, like,
right about that.
yeah, like, I don't know, I
That's
feel like I
definitely
went
true.
under, yeah, I feel like I went under the same way I came out, like just laughing.
People that go in a certain mood come out in the same way. So people that go in extra happy come out happy. We have patients that are anxious naturally, and the patients that are anxious sometimes wake up and they're in recovery crying, and they're just uncontrollably crying. There's nothing wrong. They don't have pain. They're just emotionally, I guess the emotions that kind of went in when they fell asleep kind of reappear when they wake up, and then it takes a few minutes before them to sort of settle
Mhm.
down and feel normal again. Uh, but what I'd like to get again, sort of go back to your experiences. People are terrified and scared. How scary and how painful was the whole going to sleep and waking up? What do you remember about that
Going to
aspect of it?
sleep and waking up, that was not scary. That part was, you know what? It felt like the best sleep ever. It's just that you can't remember falling asleep or waking up. But it was just
Hmm.
so like, there was nothing scary about it at all, like in my opinion. I felt like,
Yeah.
I felt like I was going in good hands and coming out in good hands. So I don't know, like, it's really not scary. You just kind of fall asleep. Like, it's kind of hard to explain, but it really isn't scary. I promise.
It, it is by far the most common few people have that they experience that. They're not afraid of surgery. They're not afraid of being cut up. They're just afraid of falling asleep and not waking up.
Oh, wow.
It's something I've been sort of trying to explore all these years because almost everybody has the same kind of fear. And again, just like you described, you kind of people are asked to count back from 10. They never make it to 1. They kind of pass out, have no recollection of what happened. Next thing they know, they're waking up. Um, People sometimes don't remember the initial first 10, 15 minutes when they woke up in recovery. Some people do like you're describing, you open your eyes. Some people just remember being wheeled out of the recovery and don't even remember spending an hour in recovery and recovering there. And very commonly, people do say, "This is the best sleep I've had." There's something about the medication, the anesthesia medication, makes you feel like you've had this very good, regenerative,
Yeah.
comfortable sleep. So you wake up so regenerative, so great. People being scared of going under and not waking up. I tell people you go to sleep every single day. This is even
Hmm.
better because there's actually a doctor that's monitoring. There's monitors checking your heart rate, your oxygenation, your blood pressure, making sure that you're 100% safe. Our anesthesia doctor is always watching you. There's always somebody making sure everything's perfectly fine. And as soon as we turn the drugs off and the drugs wear off, you start waking up. So we don't have patients waking up in the middle of surgery like you see in horror movies, and we don't have people that don't wake up when we turn the drugs off. So hopefully that kind of alleviates some of the fears that people have out there. In terms of pain, we give our patients a little pain medication before surgery. So before we go into the OR, you get a cocktail of medications to help minimize pain, help minimize nausea, and also during surgery, I put in lots of freezing. The anesthesia doctor puts in lots of pain medication. So when patients wake up, they're comfortable. They don't normally have a lot of pain. Sometimes they do, but most of the time they do not.
I had no pain. I felt great.
Sorry? You felt great.
Yeah, I felt
great.
great.
You had a lot done. What can you tell us all the procedures that you had done?
So I had a tummy tuck, like the full one across the bottom. We didn't do muscle repair. I left that up to you because we weren't sure how bad they were going to be, and you didn't feel they were bad enough to do it. I had a full anchor lift and implant.
Yeah.
And you did do a little bit of lipo on my hips.
Yeah. So if people, if you've seen, before and after pictures, you can kind of imagine that's a lot of cutting.
It's a lot.
It seems very, very scary. But, as you can hear from Desiree, she was comfortable when she woke up. We do everything possible to keep you comfortable.
Pain-wise, it really wasn't too bad. Like, even when the pain meds wore off, I mean, yeah, there's pain. I'm not going to say there isn't any. Yeah. But I had my surgery on the Monday. By the Friday, I was no longer taking the heavy pain meds anymore. I was maybe taking some Advil or Tylenol. And that was only 5 days post-op. Like, I feel like because I was so healthy and fit, it really, really helped everything just kind of mend really fast.
Yeah. So how were the first few days? Were you in bed? Were you up and about? What kind of activity were you doing?
Okay, the only up and about I did was bathroom. But I was on the couch because I had to stay bent. So I did stay on the couch, and I had to have help for like to sit up and all that kind of stuff. I was hunched over for a good 3 weeks. That I'm gonna touch on. That I was like, oh boy, I wonder how long I'm gonna be bent over for, because like it was tight for a long time, but eventually it did loosen up, obviously, because it naturally will. But yeah, at home the first few days it was fine. I went from like one couch to like a chair, couch to chair, and I had to keep doing the tightening. Right.
But you were moving, right? So what I wanted to get to is that people sometimes think that you're in bed. We don't want you to be in bed. We want you to be up and about, walking. Even if you go from the bed to a chair, back to your bed, back and forth.
Yes.
It is very, very important that people do that, because if you stay in bed for prolonged periods of time, you're at risk of blood clots in your legs called deep venous thrombosis, DVT, which can then cause blood clots to flow into your lungs, obstruct the blood flow to your lungs, which is a serious complication called pulmonary embolism. So we want to make sure it doesn't happen. If for some reason you're super weak or super nauseated or just too much pain to move, then wiggle your toes and ankles just to get the blood flow pumping in your legs to minimize the risk of these blood clots forming. So just a little sign there. Very, very important. I always stress to my patients, you must get up and move. If you can't, wiggle your toes and ankles.
I definitely did. I tried to go up the stairs, because the bathroom where the bathtub is up a flight of stairs. So there is up or down. So there was one flight of stairs in there at least once in a while, very carefully, but you have to move. You can't sit still. That is the recipe for disaster.
After tummy tuck procedure, we want people to be bent over. Sitting position is the best position. That means there's no tension on the incision. So the incision is not being pulled apart and not being pulled up. And so people stay hunched over for 2 weeks. After 2 weeks, you slowly start straightening up. And your skin is really, really tight. So that's probably what you felt, being really, really tight.
Yes.
And also, if I do muscle tightening, that's going to kind of keep you hunched down. So it can take a while before you're perfectly straight up, but it's all by design. That's intentional. The downside of that is people complain of back pain, and you will expect to have back pain after tummy tuck, after being hunched over for 2 weeks. And that back pain will go away once you straighten out. So don't get worried about it.
I would actually say the back pain was probably the worst part compared to the rest of it.
Yeah. If you have back pain, expect your back pain is going to get worse. If people have aches and muscle pains, someone like with fibromyalgia, again, you may get worse for 2 weeks. So talk to your doctor who is managing your back pain or fibromyalgia just to get ready for your surgery. and they may up your pain medications to control all these things. Let's move on to life after surgery. So you've been doing amazing after surgery. You're very, very active. Your Instagram is just phenomenal. Tell us a little bit about life now that you've shed all this extra skin. What is life like after you got rid of all this extra skin, and your breasts don't clap hoorah when you go upstairs?
No, but I clap for them. Well, last year I went back to Europe and I was really happy with myself. You know, I was able to wear the bikinis that I wanted to wear. And you know what? There might be a little line of a scar, but who cares? Because they're still inside my top and they're not falling out everywhere, you know? Now, you know, fitness for me, even before my surgery, was a very huge part of my life, and it still is now. I just really feel that, you know, if I went and spent all this time and all this money on fixing it after I lost the weight, it would be a real waste if I didn't just continue on. And so I just set new goals all the time. And even if, you know, there's small goals from today to tomorrow, like right now we're in quarantine, we're kind of suspended. So right now my goal is every day get up and do an hour. And then eventually, once the picture comes more clear, then we'll pick bigger goals. And I just try to, you know, even if it's not a goal, like for example, the fitness photo shoot, you know, like that happened because I go to Becky over back to the gym, to the Babe Cave, and she's like, okay, I was a part of this photo shoot, and you know what? They've given me the opportunity to bring it to here, to my gym. So do you guys want to be a part of it? So of course, you know, like I jumped on board. Of course, I'd love to be in a magazine. Are you kidding me? So that was the new goal. So now we have 4 months to get in even better shape to get into this magazine, you know? So it's just keeping focused and keeping goals, no matter how small, how big, whether it's a 5-minute goal or a 5-year goal or a whole bunch of 5-second goals. You know what I mean? They have to be there. If you don't have something to work towards, then you don't have direction. And without direction, you're not going to go anywhere.
There's a question I just saw went by. I was asking, what was your weight now? So have you lost any more weight after surgery, or did you stay stable, or did it go up?
No, now after surgery. So after surgery, it did kind of do this a little bit because there was a lot of different things that I couldn't do. Like, okay, before surgery, my goal was, okay, I'm not going to be able to do bench presses like I used to. So my goal was, I want to bench press 100 pounds, you know what I mean? So I was doing crazy things, you know, and now I can't do those things anymore. And because some of those things that I can't do, it's kind of like made the weight go up and down. I would say I gained maybe 10 pounds, probably within that year, but it wasn't because I was eating poorly or anything like that. It was just me learning my body again, because everything changes, right? It's like you have to adapt, and that's okay, because now we have to adapt for this, but your goal is still there, right? It's still the same mental focus. So I went up, but I came right back down. I just had to relearn what triggered it. That's all.
Okay. There was a question about the anchor. Did you call it anchor surgery? Yes. So when people get breast lifts, there's different patterns, incision patterns people can use. You can do what's called lollipop or vertical technique, or an anchor where the incision looks like an anchor. So somebody who has tremendous amount of weight loss needs the bigger scar, the bigger surgery, which is the anchor type breast lift. So that's what we talked about here. You seem very happy, and you know you set yourself a goal and you achieve the goal. How would you compare your happiness before and after?
So I've always been a pretty happy, positive person. I wouldn't say that I was terribly depressed with myself before. Um, that's a tough one, because I wouldn't say I wasn't unhappy. I was just more like, I was more defeated. I was more feeling like, are you kidding me? Like, I lost all this weight. I always said my entire life, even if I lost my boobs and I ended up with nothing, that's okay. And now I'm here and I'm like, it's not okay. So crap. So I would say that part of me was kind of sad that I had gone through the work and I tried so hard and I succeeded. I freaking got there. But it was like, it's like getting to the finish line, but it's like, nah, not quite. We're just going to give it to this person instead. And you're like, what the hell? Like, I just did all that. So that made me sad that it kind of felt like I did all this, but I'm still like, there's still something missing, you know? So that's
The
what
reason I was
ultimately.
asking, the reason I asked is we recently posted one of your before and after pictures, and while predominant majority was like super impressed and happy for you, there were a few people that
Mhm.
seemed to imply that you seemed happier before than after. So what would you say to people that would think that you may have been happier at your heavier weight than you are now?
Well, um, it's a picture. Most people smile for their picture.
Yeah.
And don't get me wrong, like I said, not that I was like depressed about my weight or anything like that. You know what? I was living with what the cards I was dealt, like these are the cards I got dealt. That's what I was living. You know, I also dealt some of those cards to myself. I made it happen to myself, but there were days and there were lots of times where I would sit there and I'd look down at my belly and I would be like, oh my God, I can grab the whole thing and shake it, and I would cry about it because it's like I just ran today. I ran today for 5 kilometers nonstop, That just because I smiled in that picture, it doesn't mean that I was fully happy, Like I lost the weight because I wanted to make me healthier, and I did. And I lost the weight because I didn't want to carry that with me. I didn't want to carry it around. Um, so I can't say, just based on looking at a picture, like anybody could say that, you're smiling in that picture, you look happier there than you are today. But, people saying those things can't define that moment or your feelings.
What advice would you give to somebody who maybe sort of in your shoes in that they've lost tremendous amount of weight, now they're left with a lot of loose skin? What would you tell them?
I get this question a lot at the gym. A lot of the girls that come to Becky's, a lot of them lose mass amounts of weight. Like a lot of the ladies that come there are seriously motivational, inspirational, like all of that. Like they move mountains, these women. And a lot of them have seen me go through it. And some of them haven't seen me go through it, but they look at me and they're like, oh, like, what did you do kind of thing? And I tell them and they're always shocked. And I explain to them because they ask me all these questions all the time. I'm like, honestly, you have to, as your own individual self, have to decide what's more important, the scars or not the scars. Um, can you take that time off of work? Can you take that time off the gym? Can you make the accountable time that you need to recoup? Because you need that. You need to have those 6 weeks of taking care of yourself, like 100%. And then the most important thing is, are you going to do this forever? Because if you're not going to do this forever, to go in there and spend 20, 30, 40, whatever $1,000 that you're going to spend to just turn around and waste it, I try to tell them, A, don't be scared. B, you have to be okay with not being perfect, because it's not going to be perfect, but it's going to be you, and it's going to be a million times better. I always tell them that, it's within yourself. It's not perfect, but it is going to be a million times better.
Tell me, when you're in the gym and you're working out, people that don't know you, do you ever someone have approached you and ask about your surgery? Do they like notice your scars or notice that you look like
No,
you've had a tummy tuck or something like that, or people
no,
can't really tell?
no, especially my belly button. I get so many compliments on my belly button. But yeah, no. And it's funny because when I first got the surgery done, a lot of my girlfriends at the gym were like, oh, let me see, how is it? And I give them updates all the time. And even now, like if somebody comes in and they've been there a while and they're asking me my opinion on it and my advice on it because they've heard through so and so that I did this or I've told them. And sometimes we go around the room and we talk about our story at the gym. um, they'll ask me like, what are the scars like? Or what was this like? What was that like? I'll show them. I really have no problem showing them my scars because A, they're not that bad. And B, it's so much better than what was there before. Like,
Yeah.
it's hard to explain. Like, it's just, I have absolutely no regrets about it. None. None whatsoever.
Awesome. If you're watching this after, or if I missed your question, please send us a DM, or I'll leave a question in the comments. We'll do our best to answer all these questions. There's a
Um,
question about, is walker beneficial? Um, if really nothing else helps, maybe, but I really don't like to see people on a walker, because usually people that have a walker tend to baby themselves. You gotta work your way through it. You gotta get up and move, um,
another thing
and get
with
a
a
body.
walker,
Hmm.
another thing with a walker is if you get what I had done, because I had both the breast augmentation with the lift and the tummy tuck. With a walker, you can't put the pressure on your arms. You
Yeah,
can't use your arms to hold yourself up. So
yeah.
if you're using a walker, you risk blowing incisions inside. So I don't think a walker is a good idea. I say just
Yeah.
take it slow. Just go slow. That's all you have to do. Like honestly, life, if you stop and think about it, is actually really long. It's us that speeds it up. So you have your whole life after your surgery to enjoy it and to take care of it. So, don't rush the healing process because you're anxious to get at it. It's coming. It came. It's
Mhm.
here. You just have to take care of it.
That's an important point. You spent all this time and effort to get here. You spent all this money getting it done. Don't mess it up by being impatient. Very, very
Hmm.
important that you follow post-op instructions. Realize that once the surgery is over, it's not over. Now you go to the recovery phase, and that's a very important phase, because no matter how hard I've tried, or another surgeon tried to give you a beautiful result, if you don't follow post-op instructions, you can totally destroy everything. So
Hmm.
be very, very careful.
Big time. I will say for me, what worked for my weight loss was the combination of cardio and weightlifting. I don't think without mixing them together, I would have gotten to where I have. And if anybody wanted to try it out, they're called Kangoo jumps. I'll show you what they look like.
Mhm.
That's it. It's a bouncy boot. Um, they take 80% of the impact off your joints and everything. And so they're really good for your adrenal system. They take the impact. They were developed for sports injuries.
Mhm.
And so people could get back to running and doing all that stuff without having to worry about the impact. So because it's a rebound sport, it burns up to 25% more calories. So I don't know if you're stuck running on the treadmill and you're sick of it, or running outside, maybe look into Kangoo jumps. So around the nipple, you can't see at all. Like that's gone. The down one, pretty much gone. And the underneath one is invisible. And the tummy one's a little bit darker, but I'm
Yeah.
also a darker skinned person. So I do scar a little darker at first, but it goes away. So
Mhm.
honestly, like even when I'm wearing a bathing suit or something like that, the scars don't affect me. I'm not self-conscious about it at all. I
Mhm.
don't feel like anybody stares at them ever. I don't feel like they're a big deal. For me
Okay.
personally, they were never a big deal.
There's a question about non-invasive fat extraction. So non-invasive treatments are always hot topic. Nobody wants scars. Nobody wants to go to surgery. So people want non-invasive fat reduction, non-invasive skin tightening. And bottom line is, we are yet to discover any technology that can really replace proper surgical skin removal and skin excision. There are things out there that do non-surgical fat melting, even though they were extremely, extremely ineffective. The amount of difference you see is so minimal that frankly, I'm not sure if it's worth the money. It's for, maybe someone who's very, very skinny and gets a little pouch in there, but it is not a replacement for a liposuction or for weight loss that should come before liposuction. And there's no non-surgical treatment that's going to tighten up the skin like a body lift or a tummy tuck would
Mhm.
do. Understand that you will have scars, and there are some
Mhm.
people for whom the scars are the worst thing ever. If you're one of those people, then maybe surgery is not for you, and that's perfectly fine. We're all a little bit different. We all have a little bit different preferences. Think about it, and if you're able to accept the scars, then you're a good candidate for surgery.
I seen a question about scar cream. I did use a
Uh-huh.
scar cream. I used the one that Dr. Six sells. I probably didn't use it as much as I should have, but it does work very well.
The number one thing you want to do is silicone, anything with silicone, whether it's silicone gel, silicone cream, silicone tape. And two, you want to avoid stressing the scar. When I say stress, I mean putting too much tension and stress and abrasion and shear on the scars. Scars that are just sitting there without any interruption heal beautifully. So that is the goal with post-surgical scars, is to try to put as little tension and shear on your scars as possible. how did other people around you respond to your to react to you having surgery? Did you get support? Did people
Um,
kind of ask you questions? Did they give you the evil eye? What happened?
oh yeah, for sure. So, I mean, there was a few people that were like, "Oh, why are you doing that? You know, you don't need to do that." And you know what? I don't need to do it, but I want to do it, and I want to do it for me. So I did. But most people were like, "Oh my God, that's so good. I want to do it." And then as soon as somebody knows that you've done it, they're in there like a dirty shirt. They want to know everything. They want to know like from start to finish because they want to go and do it, you know?
Yeah,
So, I mean,
absolutely.
I'm totally one for giving all my knowledge out. If anybody ever comes and asks me, I tell them all the time, like, do it.
Our time is going to run out real quick, so I want to put one last point about this. It is really important, guys, that you, if you decide to have surgery, that you have a good support system around you and people are going to support you. There's nothing worse than have someone, looking after you and helping you out who's just always pushing you down and saying, "Why did you do this? You have to do this. You don't need
No.
to do this," and just and that mental strain that's going to put on you is really going to interfere with your recovery, and you yourself are going to feel crappy. And these are the people that often come back and actually complain about the results when I can barely see anything because they're at home and their mother, father, sister is pointing to some little imperfections. They look how horrible that looks, and in the meantime you may look amazing. So I'm going to leave it at that before the time runs out. I want to take this little moment that's left to say thank you, Desiree, for joining us, sharing your story with us.
Thank you
Thanks
for
for coming
having
on.
me.
And again, guys, if you have questions, we haven't answered them yet, please DM us, put them in the comments below, and we'll be happy to answer. Have a great day. Thank you. Bye bye.
You too. Bye.